Your doctor has chosen the drug Albuterol Inhaler. This inhaler comes in the brand names of Preventil, Ventolin, and ProAir. Albuterol comes as an aerosol solution, a nebulizer solution, and an aerosol powder. The aerosol powder is available as a ProAir RespiClick. If you're allergic to this drug or drugs like it, please notify your physician before beginning therapy with Albuterol. Albuterol Inhaler is used to open the airways in lung diseases like asthma and COPD, chronic obstructive pulmonary disease, where bronchospasm, constriction of the airways, causes difficulty in breathing. It can be used to treat or prevent bronchospasm from causes which may be acute or exercise-induced. Albuterol is used as needed for the quick relief of bronchospasm. It is not intended to be used as a long-term preventative medication. It is often referred to as a rescue inhaler because of its ability to restore breathing quickly, which is why it is typically used on an as-needed basis. As an example, directions for an albuterol inhaler may be 1 or 2 inhalations every 4 to 6 hours as needed. Often, when the use of a second inhalation is needed for an acute attack, the best results are obtained by allowing 3 to 5 minutes between inhalations. The manufacturer recommends the use of no more than 12 inhalations in any 24-hour period. Levemir should not be used if it's cloudy, has particles in the vial, or has changed color. Do not use insulin which is out of date, has been frozen, exposed to heat or excessive light. Also, do not pre-fill syringes of insulin for future use. Do not reuse needles and syringes or other items. Please dispose of all needles in a needle sharps container. These are available for both pickup and disposal at your local pharmacy. Storage of backup vials and cartridges of Levemir should be kept in the refrigerator, while the vial currently in use must also be kept refrigerated. However, each vial is only good for 42 days once opened and should be discarded at that time. Levemir cartridges that are currently in use can be stored at room temperature for 42 days. Prozac is used to treat many conditions. These include, but are not limited to, depression, obsessive-compulsive disorder, panic attacks, and eating problems. It can be used alone or with other drugs. Prozac is in a group of drugs called SSRIs, selective serotonin reuptake inhibitors. The mechanism of action is thought to be associated with an increase in the neurotransmitter serotonin in the brain. Children and teens who take this drug may be at greater risk of having suicidal thoughts or actions. Adults may also be at risk. Patients taking Prozac should be watched closely. The doctor should be notified if the patient exhibits any unusual change in behavior. Prozac is normally taken once a day in the morning and should be taken at the same time each day. If you miss a dose, take it as soon as possible unless it's close to your next dose, in which case go back to your normal dosing schedule. To gain the most benefit, do not miss doses. For most patients, it may take several weeks to see the full effects of Prozac. Keep taking this drug as you have been told, even if you feel well. Do not stop taking this drug suddenly. If you need to stop this drug, you'll want to slowly stop it only as ordered by your doctor. Solu-Medrol may interact with other medications. It's essential that your physician and pharmacist are aware of all prescription, non-prescription, vitamins, and nutritional supplements that you're taking so that they can be accounted for in calculating your dose of Solu-Medrol. The risk versus benefit of using Solu-Medrol in both pregnancy and breastfeeding must be carefully considered before the use of this medication is started or continued. Once you no longer need the medication, or if the medication has reached the expiration date, please contact your pharmacist for proper disposal instructions. Please, under no circumstances should you flush any medications down the toilet or dump them down the sink. As a review, Solu-Medrol can be used for many conditions, including asthma, COPD, migraines, and osteoarthritis. Potential side effects of Solu-Medrol include adrenal suppression and immunosuppression. This drug should only be used as long as necessary, as determined by your physician.